in my mind, I spelled it correctly. Now, those are not difficult words. Those are the words that I could totally spell before I got sick. But my spelling, they were not correct. In my mind, I really thought they were correct, and I got frustrated with everybody who couldn't understand my writing. And then later, my husband showed me some of my writing. It did not make sense. So.
You guys have any questions you want to ask? We have a little bit of time.
Yeah, we can translate it.
Yeah, please.
Thank you both so much for your time. This is great. Thank you. It's very, very good. I appreciate it. I was wondering if you both could talk about the connection between pregnancy and then delivery, and what about access to diseases is happening.
Yeah. Well, so postpartum coronary dissection. I'll just show you.
What was the question?
So I can repeat the question. I'll just show you. So the question is, what's the connection between coronary artery dissection and the whole medical story and pregnancy? And this is one of the challenges, is that it's actually very rare, but not unheard of. So it's of the order of, nobody's ever done a study of 1,000 patients with this, but there are studies where they've put together maybe 50 or 60 patients with this, such that it's clearly a real phenomenon. The question is whether there's some genetic predisposition, because obviously every day there are thousands and millions across, maybe not millions, but there are hundreds of thousands of pregnancies across the world, and very few new mothers have happened to them what happened to Jenny. So one of the things we've actually talked about doing is looking into the genetic basis of predisposition to arterial disease, which is one of the things that we can do here at Stanford that is probably less common around the rest of the world. But in terms of what the causes, we don't know. There clearly are incredibly large changes in physiology that happen immediately after pregnancy. Immediately pre-partum, of course, the levels of many hormones are peaking that allow ligaments to be maximally elastic. For example, there's a new treatment, I probably won't cover this in your course, there's a new treatment which has been given the rather catchy title relaxin, which is actually identified from the blood of pregnant mothers, because it increases along with pregnancy, that relaxes ligaments. And it was going to be a treatment for the temporomandibular joint pain, but the company realized there's a lot more money in treating heart failure, and they changed the whole thing completely. They called it relaxin, and now they're marketing it as a treatment for heart failure. So just give you an idea, that's one hormone that's now being used as a treatment that can loosen joints. And it's an example of a class of peptides that circulate that we think are capable, and some of them actually would be steroid hormones, that would be capable of increasing the likelihood that you could have a coronary artery dissection. So it's been described. It was one of the things that we thought of when Jenny came as more likely than a clotting disorder, but certainly both things would have been possible. But also, she had made it through 2 pregnancies before without any problem. So it's very hard to know, and we certainly were never able to work out anything more specific than the general predisposition. But if you look, you'll find some case series on postpartum coronary dissection. So, and I have 2 other patients who've had this. Not her whole story, but
there's some case series on coronary dissection during delivery, but it's usually in the setting of vaginal delivery, either when the mom is having like strong contractions and there's poor pain control and there's high sympathetic tone. In this case, she had an uneventful C-section, so you were not in labor before your C-section, were you? No. So this is kind of an unrelated event.
Any other questions? Yeah.
I had really strong social support. My family, my sister here, she actually had my daughter living with her at the time. Therefore, they can take care of her. My husband can take care of the 2 older children, and also visiting me and they actually did not charge us extra money for it. This is more from the kindness of their heart they're doing it. No, she's perfectly, I think she's the healthiest of the three. Can she beat up her brothers? Yeah, she chased her brothers, there's no way she won't turn out to be a tomboy. The two brothers running ahead of her and she's chasing and screaming. Yeah, she's tougher than her brothers.
Yeah.
Thanks again for talking to us today. I'd like to know what your thoughts of the last couple of years have been about heart transplant. I know it's kind of living as something you've been trying to avoid, but can you talk to us about what that means to you?
At the very beginning, it means something scary. I couldn't even talk about it, remember? I will break down, I will cry, I was going to be very depressed. So you and my husband had to talk about it. At the time, whether I was in a hospital or once I got released, I believe the first year after I got released, I couldn't even look at my medical records. I couldn't even think about heart transplant. My husband would talk to the doctors and he would digest the information. He will feed me wherever he thinks I can handle and what I have to absolutely know. And now I think of heart transplant as hopefully I don't need it. But if I do need it by that time, hopefully the technology will be more advanced, that I probably will have an artificial heart. And like my husband said, my heart will be stronger than his. So, but I feel very blessed that I'm living with my own heart.
And this was, I think, yeah, go ahead.
I just have a question. Noise inhibition. Why noise inhibitor?
Well, you mentioned that just there. Is that true? You don't take the lisinopril anymore?
No lisinopril anymore?
I'm not
I need to check your chart. I don't think so. I think you might be on the tiny dose of lisinopril.
half a pill,
Half
half
a
a pill.
pill, yeah. I think you're right.
Oh, I think it's against what I'm about to teach.
Yeah, no.
But I'm not on that.
Yeah, not on digoxin,
No.
not on warfarin.
No.
Yes.
And
For
I'm on
spironolactone.
aspirin 81.
Yeah, and spironolactone, carvedilol, and lisinopril.
Yeah, that's it.
Yep, that's it.
And then I also added a bunch of
Textbook,
vitamins
textbook.
to myself.
Yes. One of the things we try to do, because the fact is that we have the medications and they work in the trials and they save lives, but then we have a real life patient in front of us who's getting up every day and taking pills and living her life, and days change. Some maybe the night before was a meal that was out, and there's a lot of different things, and with heart failure patients, they have to manage their lives very well. And the ones who do as well as Jenny's done, they do it because they actively manage their lives. They manage their medications, they manage their diet, they manage the support system around them, and she's done that unbelievably well. But in general, what we will do is you'll find that a number of patients with weaker hearts have low blood pressure, and we're giving 3 medications, all of which can lower the blood pressure, which is good because it's offloading the heart, it's making the heart, but sometimes we are in a situation where we can't give every one of the drugs that we want to give. But in general, what I'll do is reduce each one of those down to the lowest level so that they get some of every one of those drugs, rather than more of one and none of them.
Yeah, we went over the medications and changed it.
That's right.
Because I keep asking him, I don't want too many
Yes,
medications.
please can I take less?
Yeah.
All right, well, I think this may be a good time to wrap it up. Dr. Ashley, anybody had any last minute questions?
We have a little gift for
Oh, yeah, we have for your time and effort for telling us your amazing story. We want to just share something with you. Some flowers for.
Thank you so much.
Thank you so much, Jenny.
And